Okay, until Dr. Rehana is preparing herself, so I just repeat the scenario because I've just started recording. It's about a
Only
four-year-old.
Azan is going, yeah.
Okay, it's okay. You just take your rest. So it's about a 4-year-old boy. His name is Sam, and he is accompanied by his mother Sarah. The mother has a concern that the child has faltering growth, or he is having failure to thrive. So this is our case today to take a focus history. Dr. Rehana is my candidate. Uh, she will just start after 1 minute.
Yes, Bismillah. Okay.
Okay.
Good afternoon.
Yeah, good afternoon, doctor.
I'm Dr. Rehana, one of the candidate here today. Am I talking to Miss Sarah?
Yes, doctor, exactly.
Can I call you Sarah, if you don't mind?
Sure.
Okay, nice to meet you, Sarah.
Same here, doctor.
Just I want to tell you that I have a letter regarding your boy, Sam, that you have some concern about his growth. Can you explain me a bit more, if you don't mind?
Well, doctor, thank you so much for asking me. Well, Sam, he's a wonderful boy, and he was everything was okay until he was 3 years old. And after that, I don't know, something happened, and I mean, you can see he's just weightless. He's just no weight. So I'm very much worried for this thing that why he's just losing weight.
Okay, I can understand, Miss Sarah. I'm so sorry to hear about this. So you said that it is 3 years. So just can I ask you a little bit more that when it started, how it progressed?
Well, initially, I was just thinking that this is just a normal thing that because he's very much hyperactive, so I thought maybe he's playing more, that's why he's losing weight. But over the period of time, I mean, in the last 3 4 months, I found that he has lost a lot of weight, maybe 3.5 kilos. So that is something very much worrisome for me. So all this started around 8 months.
Okay, from 8 months. Okay.
Yeah, yeah.
Um, what did your doctor, the one who is following him, do for this concern, this concern? Did he do anything so far?
Uh,
What
well,
was?
well, the first visit was to the GP, and he
Mhm,
just saw and he said there is no worry.
mhm,
Then in the second visit, I just forced him that I have a worry, and
mhm,
then he did some blood test, which include the blood glucose test, which was normal, and
mhm,
then he did some other test for him, the blood complete picture that was also normal.
mhm.
Then when he could not find any cause, so then he referred me over here.
Okay,
Yeah.
well, that's great. We will go through for all the things, and then we'll sort out about the issue. Just I want to ask you about how the Sam, what is Sam's diet? Can you explain me his diet, what he's taking,
Doctor, he's eating everything.
everything, but
Yeah.
still he didn't gain his weight so far. Okay,
No, no,
there is
yeah,
any there is any abdominal pain along with this?
not at all.
How about his bowel habits? I mean, how is his poo? Can you describe me about his poo?
Sometime hard, but usually that's okay.
There is any diarrhea with that, if it is
No, no,
hard?
no, no, no. I never.
You mean that it's hard, he's constipated, he was having
Yes,
a constipation?
correct. Yeah.
Okay. And what did you do for this constipation? What your GP suggested for this?
Doctor, the GP just gave him Macrogol and he was fine.
And how long he took that Macrogol?
I guess 4 weeks.
And after that?
After that, he was fine. So we did not follow up with GP anymore.
Okay. And when the next time you went to GP, your concern was that still his growth is not
Yes, yes. Issue is the
healthy.
growth. Yeah, exactly.
Okay. Well, I just want to ask you other things. Is he having any like chest infection, like any frequent bug infection?
No, no.
Any disease any time he had
Sorry.
difficulty? Any chesty
No,
cough?
No,
Any breathing difficulties?
no.
Okay, what about, because he's still small, he may be not aware. What about you feel anytime he has awareness of heartbeat?
No, I think there is no such concern.
Okay, and what about his behavior? He's okay with that? He's having any behavioral changes?
I don't see that.
Okay, and his hearing and visions are okay.
Yes.
Okay, and what about his poo? Can you describe me about his poo?
I already, I think, have described that's normal.
No, no, sorry, pee.
Yeah, yeah. Well, doctor, thank you for asking me. What happened that he was not bedwetting at night, but now he's bedwetting in the morning as well. So that is also worrisome for me. But I thought maybe he's stressed up, maybe because of his losing weight.
Oh, I understand. I'm sorry to hear about that.
Yeah.
What about the bedwetting? When did it started?
We have a strong family history. The GP told me that he have a strong family history of bedwetting.
Mhm.
But the worrisome thing is that he is also doing that in the morning.
Okay, how long he was dry previously?
I think he was dry for 6 months, and then he again started to this do bedwetting.
Okay, what about this since this 6 months? Did you do
Yeah.
anything for it?
Oh well, doctor, I thought this may be normal.
Okay, I understand. And what about his school? How is his school? Is he okay? He's going school or nursery?
Yeah, he's going to school. That's fine. I mean, from the past couple of months, I'm taking regular this ping from his teacher that I mean he is unable to control his pee.
Ah, he's unable to control it.
Yeah.
And just I will go a little bit back for this your about the regarding about the poo. So
Mhm.
after this medical, he was okay and he's passing now completely stool well.
Yeah, that's fine.
Passing.
That issue was resolved after 1 month.
Okay. So school is also there is no complaint from the school.
No, 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 no,
Okay. And what about his yeah, and joints, any joint pain, any
no,
concern from the like he's walking, he's saying, Mommy, I have pain.
no.
Any skin issues like any rashes, any okay. And what about his um that's I think okay. I will just ask you about the mom if you don't mind. What
Mhm.
about his during your pregnancy and your post his delivery? Any concern about that time?
I think
In
everything was okay.
no admissions in the
No,
ICU, nothing was
no.
concerning there.
Everything was okay, doctor.
Okay, apart from these two issues, you have any other concerns for the Sam, like he was having any chronic illness before he was treated for that?
No, doctor, no such illnesses. I've told you, everything was okay back this
Okay,
8 months.
any history of travel?
Travel?
Yeah,
We do travel, doctor.
okay. Recent travel?
Uh, no, not recent. No travel.
Any any history like he has trauma?
Yeah,
Any?
doctor. Yeah. We had a car accident when we was traveling to Scotland, and at that time he got unconscious. But he was fine after that. It was almost 1 year back.
Oh, I'm really sorry to hear about that. Can you tell me then what happened at that event when this trauma happened?
Actually, this was a very severe accident. I mean, we all were safe, but he had a fracture of his bone of thigh, and
Mm-hmm.
he was unconscious for a few hours. But after that, I mean, after a few days admission, he was discharged then.
So how long he stayed in the hospital and what was done there?
Around 4 days, the bone doctor, they just fixed his broken thigh,
Mm-hmm.
and the nerve doctors, the brain doctor, they were just taking care of for him for a few time, and then he was discharged after that.
He required any fixation or anything
Oh.
for the fracture?
For the fracture, yeah, they just fixed. They just did this plaster, and he was fine.
And after that, he had been following the team, right?
Yeah, I mean now they have just removed this, so he's fine. He can walk around, so that is not an issue now.
Okay, Miss Sarah, can you just tell me about your family? How big is your family? How many kids you have?
I do have three kids. The other two, they are perfectly normal. My husband, he is working in the Middle East, and
Mhm.
yeah.
Okay, and so I guess that you are sound in your financial
Okay,
condition.
9 minutes. Okay, yeah. We don't have any issue with that.
Okay, 9 minutes finish.
Yeah, it's 9 minutes and 40 seconds. I'm sorry.
Okay. Time really flies, huh?
10 seconds extra.
Okay. Any similar condition in the family, Miss Sarah?
No, doctor. No other such condition in family.
Like anybody in the family having this bedwetting issue?
Yeah, I mean, we had when the GP was taking history. So me and my husband, we both had when we were young, we had the same problem, and even both of my kids, they had the same problem. But now they're
Oh,
okay. Both of them are now okay. The other older siblings.
okay. And just if you don't mind, I just want to quickly ask you, what about his jabs? He received all his jabs
Yeah.
and any allergy to the food and any allergy to the medication?
No.
Okay. And nutrition history. Okay. I think I finished with the history
Okay,
taking.
you still have 1 minute.
I still have 1 minute. Okay.
Yes, if you want to
Currently
give a
significant
recap, so you
exploratory
can give a recap.
Okay.
affecting the cell.
This one question is, you said me that if I'm not wrong, you said me that nothing was done for this bedwetting issue, right?
Actually, I did not told anyone about that,
Mm-hmm.
but I went to some doctor, and he started him with some medications for this bedwetting, some
What
tablets.
what was those medication?
Some
Uh,
tablets. Your time is up. You reached there very
okay.
late. Okay,
Okay.
so yeah, just you can summarize your case. Now,
Okay.
now, now, now,
Today
now we,
I
we,
took
we are we are in the discussion portion. Okay, it's 9 minutes, so we'll start at that time. Okay, just
yeah,
summarize.
I will present now the history.
Yeah.
Okay. Today I took a history from Miss Sarah, the mom of Sam, who is 4 year old. She has a concern about the Sam that he's not growing, and although he's on normal diet, but still his growth is not appropriate to his age. Um, and initially, up to 3 years, he was okay. He started this concern from 8 months of age, and some blood test was done about the glucose and other blood tests, which was normal. And he had a history of constipation, which was treated by a GP, and he's doing fine with that. And there was a car accident in Scotland, which was severe, and he required to be in hospital for 4 days, and there was a fracture in his thigh bone, and which was surgically sorted out. And surgery was done, and he went home after 4 days. And the other concern she had that he's bedwetting from the last 6 months, and had been taken some medication on that. She don't remember the name. So now, so this he's 3 years old with failure to thrive for
4 year old.
differential 4 year old, 4 year
Yeah.
old
Yeah.
for failure to thrive for differential diagnosis.
Okay.
What is it?
Yes. Okay, to reach your differential diagnosis, do you want to do some more tests?
Hmm. Yeah, I can do some
Okay,
tests.
tell me, I will give you result.
I will, first of all, I will plot him his weight and height, and I will put him in the growth chart where he is now.
Okay, his height is on 25th centile and his weight is below 3rd centile.
Okay, then I will do again, I will check his urine and I will do urine and stool analysis. I will
What
do the
what you want to see in stool analysis?
urine mainly, and
Okay, what you want to see in urine analysis?
whether there is any urine infection, UTI.
There is no UTI. What else you want to see?
I want to do I want to also see the renal function and liver function,
Normal,
thyroid function, and bone
normal,
profile.
bone profile
No
normal,
calcium.
calcium
Uh,
normal.
and I will also rule out the thyroid to see the thyroid function and vitamin D.
Okay, you did urine. Everything was normal, but the specific gravity was not good. The lab make a red flag to the specific gravity.
No, I don't know.
Okay. You want to do some more tests?
Mm.
Up till now, do you have any differential in your mind for this child faltering of growth who was normal previously, and suddenly in the last 6-7 months he dropped a lot of weight, around 4-5 kilos? So is there anything coming to your mind with increased P, also at night, also in the morning? Blood sugar
We
is
can
normal.
diabetic, but this
No, but sugar is
diabetic
normal. Sugar is normal.
blood sugar is normal. Yeah.
Yeah.
Yeah, it's a diabetic with insipidus.
That
Insipidus.
insipidus.
Actually, and as you talk, actually, it's the case. But anyhow, okay, continue. Yes.
This is maybe insipidus, diabetes insipidus.
Okay. Why there is diabetes insipidus?
Maybe due to this medication he's taking on desmopressin.
No. So you mean that, no, I mean, in your history, is there any cause because of which he has this diabetes insipidus?
He had fracture and
Yeah,
he was
trauma.
done
Very good.
surgery
Yeah, very
for
good. So he
that.
had a trauma. He was
Trauma.
unconscious. So because of that, yeah, he had this. So if you do, which single most test you will advise for this child to be sure that this is diabetes insipidus?
Urine and serum osmolality.
Very good. Okay. And sim is there any other test which is also important?
Also sodium in the urine.
Very good. So how will be the sodium in this child?
Sodium will be it will be high. It will be more than 20. I guess I don't remember the number, but
Okay,
it will
so
be high.
it will be high. Okay, very good. So if you are asked that whether Sam has cranial diabetes insipidus or the peripheral one, the renal, so I mean, how you will differentiate between the two?
You mean the cranial salt wasting?
No, I mean, there are two types of diabetes insipidus, isn't it?
CNS and the central and the renal.
Peripheral, renal, yeah. So what do you think, how you'll differentiate between the two, that Sam had central or Sam had peripheral?
I think it may be the central.
Okay, no, but how you will differentiate between the two?
The test.
Yeah.
The abbreviation test.
Okay, somebody saying water deprivation. You had very good friends around you. They are just helping you out.
Okay.
Okay, so that's it. Okay, how you're going to treat this child, Sam? Okay, everything is done. You have diagnosed him. You have done the Okay, somebody was saying water deprivation test. So how you will do that? Dr. Askar, maybe. Okay, so
You will
time we
give
have
the, you'll give the this antidiuretic hormone, right? You will check the
okay.
antidiuretic
Okay,
hormone
very
level.
good. So how you are going to give them? You will give the oral one, or you will give the nasal one, or you will give the IV one.
Nasal one, usually they are preferring the nasal one.
Okay. Which one is better? The nasal one is better or the oral one is better?
Nasal one is the better.
Okay. And which one has more complication?
One has more complication.
Okay, what is the
Yes, never.
yeah, okay, what is the only adverse effect of when the doctor is prescribing you this minor in nasal spray? So what the doctor should tell you that what can be the adverse effect?
It causes, I think, nasal hypertrophy of the nasal septum. I think I'm not.
No. There will be
Water
rebound.
toxicity. Water
Rebound.
toxicity.
Yeah,
Rebound, I don't know.
If you stop, there will be rebound.
yeah, actually, if you give, so there will be hyponatremia. Okay, so that is the
Like
only
water intoxicity, right?
yeah,
Like
yeah.
Siyada, doctor.
Yeah,
Water
Yeah.
toxicity is the second one. Yes, yeah, yes. Okay, I think your
Yes, no,
time is up. Yes, okay. So,
yes.
what is
actually,
this history, Dr. Tahir?
actually, this
So
came in exam.
it
This is a real
was
exam.
straightforward.
This is a real exam case, and I
Was
gave you so
straightforward.
many points. I gave you so many points. Who is saying Dr. Raja? Yeah,
Yes.
she's on my side. I gave you so many points. I mean, a child who had a trauma and who had excessive P problem, who was controlled previously, and now so this is you go to the secondary causes. So secondary causes is you have ruled out the UTI, you have ruled out the diabetes mellitus. So the third one is diabetes insipidus. Go for it. But anyhow, history was not bad. I mean, see, what I tell
Good,
you,
yes. It was
yeah,
so nice.
history, you were very good. You're a good historian. You reached there. And I tell you, here now we have 66 people. Take me out. 65, if I take this history from 65, all of you will reach there. All of you will take
Yes.
exactly history like this, a good one. Where is the problem? The problem is the D1 portion, where you just in your brain you just do the cooking and you just make some diagnosis and some differential. There the problem comes. Okay, and this happened with everyone, even when with us when we were studying and when we were appearing. So just try to overcome this portion. Anyone who has overcome this portion, this D1 portion, where they just do this diagnosis and just do this cooking part.
Recall history. This is recall history.
Yeah, this is recall, and this is a recent recall. It came in Malaysia, I think few months back. Every history which I do with you guys,
Even this is a war scenarios. We have patients seen like this, presenting
Yeah.
like that, and then they even Barter's children, they are presenting like that.
Yeah, exactly. And sometime I mean things can be difficult, but there will be a very good a sort of good indication will be given to you, because the examiner also they know this thing that there are just 12 minutes. Okay, so they will definitely give you some big thing. Okay, the history, it was very good. You took very good history. If I'm an examiner, I'll give you full marks for the way you took the history. But the problem arises when you I just give you one idea. This is a top tip for your exam, for everyone. When you're taking history, it's not about the history station. It's even about the clinical station. It's even about the development station. Everyone, when you're doing something, practice it this way, that why I am doing it, why I am asking this question. Like when you just keep guessing yourself, so your mind will be working, and there will be some diagnosis coming to your mind. Like for example, you ask me, was there any history of trauma? Why you ask me trauma? Was that the type of history which you already have just memorized and you just want me to ask that again and again? No, there should be something at the back of your mind that why I'm asking trauma here. I was very, very happy. I was so happy when you asked me trauma. I thought
I-
she reached there.
I was actually thinking that there is nothing. There was constipation, which was already sorted out. Bedwetting is recently. Maybe there is any reason for this bedwetting. So I will ask about trauma, treatment, all those previous things. That's why I ask you.
The discussion portion, Dr. Hannah, discussion portion will not be difficult. When you come across history like this one, like this is a difficult history. So the discussion portion of the D1 portion where the diagnosis, differential diagnosis, that will be difficult one. After that, they will not tease you, honestly. When you have a difficult case, they will not tease you after that. Okay. So the initial 3-4 minute of